Have you experienced food poisoning or other sorts of infection? Then 2 weeks after, the whole body, knee and other joints suddenly becomes swollen. That's not a coincidence. Remember, there was no injury, there was no bacteria in the joint, just an infection. But your immune system is still fighting something that's already gone. This is the reality of reactive arthritis. Reactive arthritis is an immune-mediated inflammatory joint condition that happens after an infection, usually from the gut, the stomach, or your urinary tract. The joint itself is completely sterile. There are no bacteria inside, but the immune system behaves as if they were. Reactive arthritis is commonly triggered by infections like food poisoning or sexually transmitted infections like chlamydia. So the body fights off the infection, but then forgets to switch off properly. In a simple term, you get an infection, your body fends it off, but it starts attacking its own joints. So, what exactly is happening inside this body? After the infection clears, fragments of bacterial proteins will remain inside the immune cells. These immune cells can travel down to the joints or other parts of the body. And this is where the immune system mistakenly attacks this joint tissue, thinking it's still part of the infection. This immune response launches inflammation against the joint lining, the tendons, and the entheses where the tendons attach to the bone. Around 2/3 of patients carrying a gene called HLA-B27. This gene doesn't cause the disease, but it makes the immune system more likely to overreact after any infection. And clinically, it often presents with sudden onset, swollen knees or ankle, Achilles and heel pain, and swollen toes, sometimes called sausage toes. Reactive arthritis is part of a spondyloarthritis family. It can also cause red or painful eyes, painful urination, mouth ulcers, skin rashes on the palms or the soles. And here is where people get it all wrong. Antibiotics would not fix the problem because by the time the arthritis develops, the original infection is usually gone. This issue is the body overreacting and not the infection itself. And this process is sometimes called immune dysregulation. Treatment focuses on calming the inflammation, which involves the use of non-steroidal anti-inflammatory medication, steroids, and sometimes disease-modifying anti-rheumatic drugs. Most patients would recover within 6 to 12 months, but around 20 to 30% develop long-term joint problems called chronic spondyloarthritis. And this is the reason why early recognition really matters. In a nutshell, reactive arthritis is not infection in the joint. It is the immune system reacting to an infection that had already happened. The bug is gone, but the immune system did not get the memo.